Hi, my name is Tara, and I will be here to show you how to do some maneuvers to open up airways, whether to check an unconscious person, choking, or beginning to do CPR. Right now, we're going to show you how to do the head tilt chin lift. It's a very simple maneuver, and it's often used when somebody is unresponsive. You can check to see if they're breathing or not. Sometimes just opening somebody's airway, if they're not breathing, it might be just as simple as head tilt chin lift. You do want to use the head tilt chin lift maneuver when you see that you don't suspect any signs of trauma or cervical injuries. What you want to do is you take your hand and you place it on the forehead of the patient. Your fingers go up underneath the chin. You want to make sure that you get the bone of the chin. You go down too far, you touch underneath your neck here, you'll feel your tongue go up and down. You can actually block the airway by trying to open the airway. So, hands, palm of your hand, and you are going to head tilt, chin lift. Everybody's head is different. Some people, you really have to kind of get up underneath that chin to lift, and you have to press kind of pretty hard. Also depends on the surface that the patient is laying on. Rugs, rubber mats, you might have to work a little bit harder to get that head up. Sometimes that simple maneuver, all of a sudden, that patient is going to start breathing again. Another way to open up an airway is called the jaw thrust. That is used when you suspect a neck injury. Not everybody that's unconscious is a trauma victim. That's when you have to take in the scene size up. You show up at a house, patient's in the front yard, but there's a ladder that's laying next to them and there are tools everywhere. Maybe they were cleaning the gutters. This is when you want to err on the side of caution, thinking that maybe there might be a cervical injury, whether you see it or not. If the patient is unconscious and you suspect it, number one, you just want to make sure, you kind of check to make sure that there's no step off or anything on the neck, in the back of the neck. But what you also want to do is do the modified jaw thrust. Contraindication, if there's any obvious injury to the face, you don't want to do it. Broken nose, raccoon eyes, or anything like that, because you can actually make the injury worse. So you want to do the jaw thrust when you suspect cervical injury without facial injuries. Right underneath here, you're going to use that as an anchor for your thumbs, like so. You're going to take your fingers and you're going to go up underneath. Now, unfortunately, this mannequin won't really show you how you can do that, but I can show you where you're going to hand placement. Fingers here, thumb here, and you're literally going to hook your fingers up underneath that jawline and you're going to lift to the sky. And when you do that, you're pretty much displacing the mandible and so, whoo, like that. You can do it to yourself, you can do it to your friends, like that. And that's what you're going to do. Again, contraindication is there any facial injuries. There is one, again, everyone's made different. Sometimes putting somebody in what's called the sniffing position. Sniffing position is really when you see like the ears, everything's lined up in a straight line. So sometimes it's just a matter of maybe putting some towels or even your hand behind the shoulders, in between the shoulder blades, and it just atomically gets their airway in a line position. Sometimes it's a matter of just kind of taking a look at their ears and lining them up with their chest or with their heart. And sometimes that will open up the airway. Everybody's different. You may have to do the head tilt chin lift. You may have to do just the sniffing position. Everybody's anatomy is different. But these are little things that you can use. While you're doing the head tilt chin lift, you also can look in the airway or the sniffing position. And that's when you can see if there's maybe an object in there that's blocking the airway or causing it. But sometimes if somebody goes unconscious, it's just everything, all the muscles and everything just relaxes. Positioning, are they on the ground? Are they on the couch? Like this. Sometimes getting on a flat surface and then just opening their airway. Simple as that. Can all of a sudden they'll start breathing again. Are there any questions? Anybody have any questions?
No, that was clear.
Okay. All right. I just want to make sure. In other instruction videos we'll go over, or any other classes we'll go over choking, but this is the very, very basic. When you come upon an unconscious patient, when you do not suspect a cervical injury, head tilt, chin lift. And again, placement is very important. Don't get that soft spot underneath here, underneath the chin, like that. And also the modified jaw thrust, or the jaw thrust. When you do suspect a cervical injury but no facial trauma, thumbs, jawline, and lift to the sky. It is a hard maneuver because pretty much when you're there until an advanced airway is placed. You're pretty much stuck if you're on the airway. And it will get tiring. You do want to try to get an advanced airway in as soon as possible, just to make sure, because it is a very hard position to maintain. It's very, very hard on the hands, especially if there's suctioning that has to be done. That is all I have. If there's no questions, again, my name is Tara Cullen, and this was basic BLS airway management.